Welcome to Medicwise TV. Today is a Sunday afternoon, Sunday evening, and as usual, we are here for the healthcare discussions. We say Medicwise TV is an haven for healthcare conversations. And this particular day is a day for Genesis in the house. And we have here a young man by the name Brian Mutinda, a radiographer by profession, just qualified recently and joined the radiography profession, and is burning with passion to talk about the nuclear medicine radiography, which is his area of specialization, which is his area of interest. He has a lot of interest in nuclear radiography. So welcome to this kind of conversations. I'm your host, Didacus Mochache, aka Dida the X-ray man. Welcome, Mr. Mutinda Brian.
Pleasure meeting you.
Very young Genesis. Could you please introduce yourself to our audience?
My name is Brian Mutinda. It's a pleasure having this conversation with Didacus. We have known each other since my time at the campus, and by profession, I am a qualified radiographer, just newly graduated, and I have chosen to specialize in nuclear medicine, which is a part of medical imaging. In nuclear medicine, we use little amounts of radioactive tracers to look at various diseases, and we also, it's very important because apart from looking at the anatomical features of the body, it also looks at the function, which is very important for diagnosing various diseases.
Wow, this is very good to find a young radiographer like this, like you, who has passion in a very, not very familiar subspecialty in radiography. So maybe take us through your journey. How did you get interested in nuclear medicine?
Well, to be honest with you, I did not land into nuclear medicine because of one reason. Not one reason pushed me into nuclear medicine. Rather, it's a combination of a lot of things. First of all, I had a very different experience with nuclear medicine at first in my time at the campus, because we touched on all the other modalities in school, but very little on nuclear medicine. So that is why I got interested to learn more about nuclear medicine. Therefore, I made a vow that I would attach myself to a nuclear medicine facility here in Kenya. I understood that there are very few chances available for students, but I made sure that I got attached to one of the very good facilities in Kenya, one of the 6 facilities now that are offering nuclear medicine. And I did my 6 months long attachment at the KUTRRH, and that is the IMIC, which is the Integrated Molecular Imaging Center. There I got to interact with one of the best teams in nuclear medicine, and I also got mentorship from the same people. That also encouraged me to remain in the field because they showed me an area that I didn't imagine existed in medical imaging. Yeah.
Wow. Now, in radiography as a profession, the subspecialties which are very common is ultrasound, CT scan,
Yes.
MRI. Recently, KMTC has started training subspecialties in CT scan, MRI, and echo.
Yes.
We don't have any formal training, as far as I know, in Kenya in nuclear medicine.
That is true.
Do you find this as a big challenge?
That is a big challenge for us also, yeah, because we have to, if you want to gain any formal education on the same field, you have to go outside Kenya, which might be a challenge in terms of the finances. But where there is a will, there is a way.
There's a way.
Yes.
Have you met any senior radiographers who are formerly trained in nuclear medicine radiography?
Yes.
Kenyans?
Yes, there are few. I can count them. There are
Okay.
very few, but I've met them. We have had conversations on how I can best progress in the field. But like I said, where there's a will, there's a way. So I found an online course through the IAEA, and it's a nucleus program where they are offering training on PET-CT and SPECT-CT. That has really helped me. I should be completing that in a few.
So you are
In a few
you have
weeks.
already enrolled in an online course.
Yes.
And you are continuing to study through that online course. You are studying nuclear medicine radiography.
True.
So maybe being a not very familiar subspecialty of radiography, can you explain briefly what it entails? What is the work of the nuclear medicine radiographer like you?
Okay. So simply put, first of all, that's a very good question. And simply put, in nuclear medicine, we use trace amounts of the radiopharmaceutical, which is basically the torch that guides us to where the problem is inside the patient's body. And the machines detect exactly where the tracer goes. So it's a very small amount of radioactive bit that is injected into the patient's body. Once it's introduced, it's given enough time to settle in the body and also clear from the blood pool, which helps also in the image quality. During the imaging, the machine is specifically made to capture areas where there is a lot of concentration of that drug. So it's only going to pick areas where the drug has gone. There is physiologic uptake and there is pathological uptake. Where the physiologic uptake is, for instance, if you're using a tracer like the F18FDG, which is majorly used in the field, it tracks any place in the body that is going to use glucose. So that is physiologic uptake. It's going to go to the brain. It's also been eliminated naturally by the body via the urinary system. Now, if a patient, let me give a case example.
Yes.
If a patient has breast cancer, and they've already been diagnosed with breast cancer, their doctor has sent for this examination to check for the progress of the disease, whether the treatment that the doctor is using is working. So the patient is going to be sent to a department for this examination. The tracer is only going to concentrate in areas where there are cancer cells, and by nature cancer cells are using a lot of glucose, right?
Okay, I see.
So this F18FDG, which is a glucose analog, it is not really a glucose, but it's a glucose analog, which means it behaves mostly the way glucose behaves when it's induced inside the body. So it's only going to go in areas where there's a lot of glucose metabolism. Is that understood?
Okay.
Yes. That is how we are able to track how the patient is progressing.
People say dealing with the nucleates, I think the tracers are nucleates.
Yes.
Isn't that right?
The tracers are?
The tracers are nucleates? Ions, so what are they?
So a tracer is basically a radioactive bit that is linked to a ligand, and the ligand is the functional bit of that drug.
Okay, fine. My point comes in here. This is radioactivity. And they say working in such an environment is very risky to your health. Do you have that kind of concerns?
Not really.
Because this is radioactive
Yes.
materials, as much as it is being used for therapeutic or diagnostic
Yes.
purposes. Are you concerned because you will have to work within an environment of radioactive materials?
I understand the concern. It's a very good concern when it comes to dealing with nuclear things.
Yes, yes.
There is that what do we say? It's people fear anything that is linked with nuclear things.
Yes.
And that is understandable. But I'm here today to decommission that belief, because when you're working in a radioactive area, there are measures that are put in place by the institution to protect the workforce from excess radiation exposure. For instance, we use the lead blocks.
Yes.
We use the lead blocks that are able to stop the radiation that are being emitted by these radio tracers. We also ensure that we spend the minimum time possible with while handling the radio tracers. We also have our radiation badges and our ring dosimeters, which at the end of the month tell us how much we are consuming, we are getting, or rather we are being exposed to at the end of the month. Now, the concern to the patient is very little because, like I said, we use very small amounts of radioactive material. They are a bit radioactive during the period while we are scanning them, but it is important. Okay. And we look at the risk and the benefit of these tracers. The risk far outweigh the benefits. Yes, because for this patient, it means that they are going to get early diagnosis, which is going to affect the way the doctor manages their condition. And by the time they leave our department, they are free to go and do any other thing.
And maybe you can also highlight, because it's not obvious that many of our viewers know that we have very few centers, yes, which do or practice nuclear imaging.
Yes.
So maybe you can mention to our viewers how many do we have in Kenya, okay, which you know.
Okay, so maybe I start at where we started in Kenya. It's a limited practice,
yes,
but it will surprise you to know that Aga Khan started way back in 2002 with a gamma camera. It was only one at that time, and then in 2019 they acquired a PET CT machine. So we had now 2 units in Kenya, and since then we have seen the progress, because right now we have 6 centers with 7 PET CT machines and I think 3 gamma cameras. So we are making considerably good progress in that field, and I believe that the future of nuclear medicine is looking very good.
And we know it is capital intensive to invest in equipment in nuclear imaging.
Mm-hmm. True.
And rarely is it found in Kenya, like you have explained.
Yes.
So have you heard of any measures on investment in this area of nuclear medicine so that it can expand?
Well, I'm just starting, so I believe I need to do more research to understand why it is so expensive. Maybe we can get it at a lower cost, but it's something that I can look into.
What are some of the common ailments which are diagnosed? I know being tracers,
yes,
you know, uptake, cancer cells uptake. So basically it means nuclear radiography is here to diagnose cancer as a major issue.
Yes.
So what are the common cancers which are being diagnosed when you do these examinations?
So different tracers are made for different conditions. For instance, for the tumor-forming cancers like the breast cancer, the cervical cancer, we can use F18FDG. For prostate cancer, we can use another tracer which is specifically made to target prostate cancer. But it's not entirely dealing with cancer alone, because now when we cross over to the SPECT CT side, we are going to be seeing patients with kidney functions. The patients might be sent for kidney function tests,
yes,
for assessment of the heart function,
yes,
and also metastasis to the bones. So there are various tracers that are made specifically to track different organs inside the body. We have one tracer for the prostate, for the thyroid, it's different. So we have a lot of tracers that are already in the market and others that are already being done research on.
Well, that is well explained.
Yes.
However, I just wanted to know which is the common cancer which is commonly diagnosed using nuclear
medicine.
Yes.
In women, I would say breast cancer.
Breast cancer is very common.
We see a lot of breast cancers.
Yes.
But recently, we are seeing a lot of esophageal cancer, colorectal cancer among the young people, and not many lymphomas, but
okay,
they are there. We also seen a lot of cervical cancer among the women, but when it comes to, if we can group these two in terms of the gender, when it comes to the females, a lot of it is the breast cancer, and for the male, it's the prostate cancer.
Have you had any impact on AI, on nuclear medicine? What is the future of AI in terms of nuclear medicine? Nuclear medicine radiography? Are you seeing AI impacting?
So currently we have some programs that are running on AI in our machines. They do a lot of the reconstruction.
There is AI learning?
Yes.
Okay.
Yes. They do the reconstruction of the images for us. And I believe this is a conversation that we cannot escape, because you see, radiography as a field is fast-paced. A lot of things are just coming in, like the AI, as you're mentioning, and I believe that any radiographer who wants to remain relevant in the field should and must, I say must because
acquaint himself with AI.
Yes.
So AI is here, and you believe it is going to heavily impact the way we do diagnosis in nuclear medicine radiography?
Yes, it's not entirely going to do away with what we are currently doing, but it's going to help us do our analysis when it comes to image interpretation, and also helping us with the workflow of in the nuclear medicine.
Wow, that's good, very good. Maybe what machines? What in nuclear medicine? I think like any general radiography, we use machines like CT scan machine,
yes,
MRI machine, or if we are doing the general X-ray, you use the general X-ray machine.
Yes.
And maybe in ultrasound we use a ultrasound unit. What is the name of the machines used in nuclear medicine?
So we have,
and if there are a number of them, it's good to mention them.
Yes, that's a good question. So unlike the conventional radiography area, where we have machines that are looking at mostly the structures of the body, inside the body, in nuclear medicine we have two different machines.
Okay.
The PET-CT.
PET-CT.
Yes. This is an hybrid system that has a CT gantry and a PET gantry. The CT gantry gives us the anatomy of the patient's body, and then the PET gives us the emission. Remember, I said that once we inject the radio tracer inside the patient's body, the machine now creates a map of where that tracer has concentrated.
Yes.
So the PET gantry is the one that does the emission scan.
Okay.
Yes. Now linking the two images gives you the PET-CT image, which is a fused image of the CT and the PET.
I see.
Yes. Now again, we also have the SPECT-CT machine. This is mostly used for assessing kidney functions and the heart and the thyroid, and maybe checking for issues with the bones, like the metastasis of the cancer to the bones, mostly. So we have the PET-CT and the SPECT-CT. Although the PET-CT can also be linked with an MR equipment. So instead of the CT giving the anatomy, it's an MRI machine giving the anatomy, but that is something that has just recently
So there is also incorporation of MRI technology in doing nuclear radiography, wherever.
Yes, but it is worth mentioning that in Kenya we currently don't have a PET-MR machine, but I believe it's going to be there in the near future. We have one.
So we absolutely have not even one in Kenya.
Yes, but we have 7 PET-CT machines.
But we have 7 PET-CT machines.
Yes.
Okay. I see. This is this is the information we take for obvious to assume. We have assumptions that it is obvious, but it may not be that obvious. Currently, you work where?
I am working at Ruai Family Hospital. That is where I'm currently working, yes.
So Ruai Family Hospital has got a PET-CT
it has one unit.
Services, and they are happening there?
Yes, we are currently doing the PET-CT imaging and also SPECT-CT.
Okay, fine. I think you have a lot of information to give about nuclear medicine radiography. However, I would wish us to change the topic a bit and let's talk about maybe leadership in our profession. Now that you are a young radiographer,
Yes.
an emerging nuclear medicine radiographer, I can say self motivated, you know, because you are doing your courses online.
Yes.
There's no formal training of this in Kenya. You are taking an extra effort to do this subspecialty on your own. What do you think about the Society of Radiography in Kenya leadership? What do they need to do so that we can have more people like you being formally trained as nuclear medicine radiographers?
Well, right now, SOC is undergoing a lot of transformation, I believe so. So I will refrain from giving any comments in regards to the leadership. But in terms of what they can do for young radiographers,
Yes.
and also people who are joining the field of radiography, they can spread awareness about this field because our curriculum doesn't do much
About
in
it.
terms of nuclear medicine and radiotherapy, but we concentrate so much on the X-ray and CT and MRI, which is a good thing. There are people who are passionate about that, but for others who want to diversify and go maybe a little bit off from what most people are doing, they can spread awareness about this. And also, when they are doing so, they should mention that they are limited. The nuclear medicine practice is limited in Kenya, but that doesn't mean that we cannot take our radiographers outside Kenya. So also, to the students, they should not have their mind confined to the Kenyan landscape alone. They can look for opportunities outside, and I'm sure there are a lot of them. And also in terms of, that's on the clinical side. I believe that there is more that needs to be done in terms of research. You can have research radiographers maybe, and also I believe we have also not tapped into the field of business, which I think would benefit our radiographers, our young radiographers. Know that it's not only about the clinical aspect of radiography, but you can look at other areas such as the research and the business. And also, you should understand that when you are a radiographer, you can move into other fields that are within our field, such as radiation safety. You can do a whole new thing on radiation safety, which is very important when it comes to mostly nuclear
Now,
medicine.
Mr. Mutinda Brian,
Yes.
a GNSC who has taken up a very unique subspecialty in radiography, what is what advice would you give young radiographers like you, GNSC, who want also maybe to follow in the footsteps of nuclear medicine radiography?
Okay. So anyone out there who wants to join nuclear medicine, please keep the focus. There's nothing that is practically impossible to achieve in this world. So believe in yourself, because I'll just share a small story. Growing up in this field has not been easy also.
Yeah.
I mean, I had a mentor who has taken, I have a mentor who has taken me through everything that I practically need to know. But outside there, I used to get a lot of voices just getting to me, like it's a limited practice. But don't listen to that, because I joined this field when I didn't have any idea of where I would practice after high school, after campus. But right now, opportunities are there. I can say that when we are talking about opportunities even outside Kenya, it is very true. So we need to focus more than just the Kenyan landscape right now. Yeah.
So we have an AGM, radiographers AGM is happening next week. As a GNSC, what do you say about this? Are you a member of the Society of Radiography in Kenya? And if you are a member, what kind of encouragement do you give young radiographers so that they can attend the IGM next week?
Okay, that's a good question, because I believe there's a lot of motion going around that SOC is not doing enough, but we need to give it the benefit of the doubt. That is my opinion, because I believe, like I said, they are undergoing a lot of restructuring. Yes, and we need to give them time. Myself, I'm a fully paid member of SOC, and it did not come easy. It took a lot of convincing, yes, but I saw the brighter picture. I saw the reason why we need to support our own. This is our body. It is just growing. So if you are out there and you are like wrestling with the idea of joining SOC, please join SOC, because it needs the members for the motions to be moved forward. Maybe if it's something that we need to table in the parliament, we need to have the numbers, and it's only going to come from us, radiographers, young professionals who are just joining the field. Do not abandon the parent body that is trying to uplift us. Yes.
And do you think SOC is doing enough in reaching you young GNSC radiographers with information about what is happening in the Society of Radiography in Kenya?
There is a lot more they can do. Like I said, they can spread awareness about the specialized fields such as radio. Have their issues solved is by joining SOC, so that you can bring the change that you want to see in the body while you are inside there. So if you're just outside, you realize there is nothing we are going to change. But if we are part of this SOC and we believe that the management is not doing enough, then join SOC and do something about it.
You said earlier you are enrolled,
yes,
doing an online nuclear medicine course.
Yes.
Maybe you can tell the members how long is this course, and maybe how much are you paying? What is the tuition fee online for you to be able to achieve this mean feat,
yes,
of working on your own to be trained online?
Yes.
Yeah.
So good question also. What I have to say about the course is that it is purely free of charge.
It is free of charge?
Yes. It takes 12 weeks, very short course, but it needs a lot of commitment also, because you have to do a test at the end of the program so that they can assess whether you've been seriously taking the classes.
The classes, yeah.
Yes. So for you to enroll, you only need to go into the IAEA website under the nucleus program and pick literally any course that you want to pick.
IAEA is the International
Atomic Energy Agency.
Atomic Energy Agency.
Yes.
So this course is offered through the website of International Atomic Agency.
Yes.
And it is absolutely free of charge.
It's absolutely free.
There you go, members who want to enroll in nuclear medicine radiography, take the chance and contact Mr. Brian Mutinda so that he can be able to show you how these things happen. On your screen we have our number, WhatsApp number. You can be able to text and send a message, and we can be able to give you Mr. Mutinda's contact so that you can speak to him directly. So Mr. Mutinda, we also have the scientific conference, Radiographers Scientific Conference, happening in September. Do you have any few you can give about it? We know there will be international guests that time. Do you have a paper to present in nuclear medicine or in nuclear radiography?
I surely have one. It's in the making.
Okay.
And I believe that it is going to be an eye-opener in terms of outlining where we are at currently and where we are coming from. And now, to anybody out there who wants to maybe contribute actively during the 11th RASCO, please send in your abstracts. I believe if you have a good idea, it is worth sharing, and it will also give them a good platform to interact with senior radiographers in the field and also exchange in terms. And this is going to help us like move forward as a profession. Yes.
So you are rooting for young members to participate fully
Yes.
during the upcoming RASCO conference happening in September in Kisumu City.
Yes, sure thing.
So, and you promise people you will be there personally presenting a paper.
If my paper is accepted, yes.
Do you have any plans to pursue further studies, further formal studies in nuclear radiography in the near future?
Currently, yes. I would like to get a formal education on the same. I believe it's going to be a challenge because for you to get a real degree, because
Yes.
you understand the IAA is only going to give you a certificate,
Okay.
which is enough, yes, but there are some institutions before employment, they're going to need you to give like a real paper that is not just a certificate of completion of some free education somewhere, which is a good thing, but I am planning.
And it is only you who can take it up the way it has been demonstrated. So to our viewers, we appreciate you and we appreciate your being here. Remember to keep it here in Medicwise TV, and remember to subscribe to our YouTube page and give us your support through subscribing. Medicwise TV is sponsored by RadMed Connect, Sublime.
Welcome to RadMed, your 360 degrees radiology and healthcare partner. Shop for all your radiology needs, from X-ray machines to ultrasound machines, we have it all. At RadMed, we are dedicated to revolutionizing healthcare. We are experts in radiology and healthcare equipments, serving all areas in Kenya. Why should you choose RadMed? Firstly, we provide high quality and reliable modern technology hospital equipments. Secondly, we provide personalized support for every client. Thirdly, we have a proven track record in successful installations. Globe Care Hospital in Eastleigh, we delivered and installed an X-ray machine. Lydia Key Memorial Hospital, we delivered and installed an X-ray machine and a computed radiography machine. In Calvary Hill Hospital, we delivered and installed an X-ray machine with a CR. In Ziwa Hospital, we delivered and installed an X-ray machine with a complete CR. In Mwanzawetu Health Services, we delivered and installed a colour Doppler machine with 2 probes. Brooks and Cherith Hospital, we delivered and installed an X-ray machine with a CR. In Nanyuki Hospital, we delivered and installed an X-ray machine. Esobi Healthcare. Malkia Wings Hospital. Zenit Care Hospital. Nelly Nursing Home. Pro Care Cottage Hospital. Esther, a radiology entrepreneur. Itak Hospital. Peter, a radiology entrepreneur. Mugamo Medical Center. Jabs Medical Center. Why should you choose RadMed? Firstly, we provide high quality and reliable modern technology hospital equipments. Secondly, we provide personalised support for every client. Thirdly, we have a proven track record in successful installations. Welcome to RadMed, your 360 degrees radiology and healthcare partner. Shop for all your radiology needs, from X-ray machines to ultrasound machines. We have it all. At RadMed, we are dedicated to revolutionising healthcare. We are experts in radiology